All right, well, good afternoon, everyone. I'm Amber Blakely. I'm the conference chair for this year's annual virtual conference. We typically hold these in various places throughout the US, usually at a campus that has a PSM program. And so this year, of course, we went virtual. Just this past week, we had two very good presentations. These are all kind of geared towards program directors, administrators, faculty, alumni, students. And just so you're aware, there are a few ways that you can get involved and learn more about our association, which is, again, really for the Professional Science Masters initiative. We offer regular newsletters that get sent out to members through email. These are things that programs can contribute towards, where you can put together an article or highlight students and alumni. You can also volunteer to serve on various committees, different initiatives that we have going on. A couple of these are kind of listed here. There are certainly some membership benefits for those looking to get involved. We have a Slack channel. We are on the various social media listed here, so that would certainly be an easy way to learn more about us. And we hope to see you in Tampa next year. This is, of course, where we were going to meet for this conference. We're really looking forward to hopefully meeting in person next year. So usually the student presentation is something everyone really looks forward to hear from students from different universities and programs. I know it's certainly one of my favorites, and I'm really excited that we can still offer this and be able to invite other people to be able to join. So I'll let Ray take it from here and introduce our students.
All right, thank you, Amber. So I'm Ray Hoobler. I'm with the University of Utah. We have several PSM programs here. And I just like to say that over the last, as Amber said, over the last several years, we've had students and alumni present at our national conference. And so even though we were doing virtual conferencing this year, we really didn't want to lose the chance to hear about what our students and alumni did as part of their degree programs. And so we did things a little bit different this time. So for this session, we asked students to prepare a 5-minute video summarizing their work. And we didn't put a lot of guidelines on it other than the timeline. So we were looking basically to ask them to choose something that would work for them. And so while it may not be typical for professionals to deliver presentations in a video format, many meetings are being recorded, just as this one is today. They're being shared. And so video presentations may provide an excellent framework to simulate this type of practice. So this may become the new normal, and so we should expect that perhaps creating content becomes a professional skill of this generation. So the video presentations today will be given by Ashley Malone from the University of West Florida, Cynthia Miller from the University of Findlay, Krudika Raman from Rutgers University, Kendall Stauffer from the University of Utah, and Jake Strong from the University of Utah. So I placed the presentations in a random order, and the idea is that we'll present them consecutively, share those, and then we'll have a chance to talk with the presenters after the completion. So they're 5 minutes. We have 5-minute videos, so 25 minutes. So with that, I'm going to just again thank the presenters for putting this work in, for being with us today. And unless Amber has a question, I think I'm going to start the first video. All righty. And you'll have to apologize for a little bit of just getting it. There we go. And don't forget, we can use the reactions button there at the bottom. So thank you.
Okay, it's recording. Hello everybody, this is Jake, and I'm a recent graduate from the PSM Biotechnology program at the University of Utah. And this is my multimedia overview for my professional experience presentation completed last year at the Dysgenics, and this is for educational purposes and therefore under fair use. Dysgenics is currently in the process of developing a cell therapy drug product and building its manufacturing facilities here in the Utah Valley. Their novel therapy is intended to treat lower back pain that's caused by degenerative disc disease. About when I started as an analytical scientist in the R&D department, Dysgenics received its Fast Track designation from the FDA, as well as approval on their investigational new drug application for IDCT, their proprietary injectable disc cell therapy. Unless you've been living under a rock this past year, I'm sure you've seen the terms investigational new drug and fast-tracked used with regards to the vaccine race under Operation Warp Speed. Essentially, these are terms used by the FDA in the regulatory pathway for bringing a new drug to market. The FDA regulates biologic therapies depending on a variety of criteria, such as tissue origin, chemical or genetic manipulations, and the intended use. IDCT is an allogeneic homologous cell therapy, meaning that it's composed of discogenic cells that are intended for a genetically dissimilar patient. In other words, these are progenitor cells extracted from a donor's spinal tissue and are intended for injection. The FDA regulates biologic therapies depending on a variety of criteria, such as tissue origin, chemical or genetic manipulations, and the intended use. Along the regulatory pathway for tissue-engineered products or any drug being manufactured, you have to give the FDA your exact process for manufacturing. Each laboratory test system used to document the manufacturing process requires its accuracy, precision, repeatability, and linearity to be determined. My project documented the analytical method qualification for the QMOD holographic imaging system made by Ovisio. And this system is used in various points through the manufacturing process of the extraction, differentiation, and outgrowth of the discogenic cell. If you're interested in the exact testing methodology used for the qualification process, you can read my project report that can be found at the University of Utah, or you can go directly to the source of the International Council on Harmonization, Q2R1. However, to focus on more relevant aspects, Dysgenics is ultimately in the process of manufacturing a cell therapy drug to treat lower back pain related to disc degeneration. Approximately 1 in every 4 adults will experience debilitating lower back pain from disc degeneration. Currently, there is no treatment besides painkillers or surgical intervention. An interesting news thread recounting Dysgenics' early days and the development behind IDCT's biotechnology is about the neurosurgeon Christopher Dutch. You might recognize the name from the podcast Dr. Death. During Dr. Dutch's residency as a neurosurgeon, he teamed up with 2 Russian scientists to explore the commercial potential of stem cell treatments. They patented technology to obtain and grow disc stem cells in 2008 and started Dysgenics to develop and sell such products. As a side note, the TV series drama about Dr. Dutch will be coming out next year, and I'm sure Dysgenics is going to be having a screening party at their manufacturing warehouse. I won't go too far down this rabbit hole, but it's definitely an interesting story and worth a listen. Anyways, enough of that tangent. So even if you live under a rock, sit at a desk all day, or engage in high-impact sports, many of you will suffer from disc degeneration. Dysgenics' novel cell therapy product is hoping to change the paradigm of current treatment options by bringing IDCT to market, thereby disrupting a $100 billion industry of lower back pain-related opiate prescriptions and surgical intervention. Thank you all for watching, and I'll look forward to answering your questions.
Alrighty.
Hello, my name is Ashley Malone, and I'm presenting on my capstone project, which was an analysis and visualization of Port Orange, Florida sidewalk survey data to facilitate infrastructure repair and improvement. A little bit about me. I'm a Geographic Information System Analyst for the City of Port Orange, Florida, and a recent graduate of the University of West Florida. My project centered around a sidewalk survey that was conducted by the city in 2019 to assess the infrastructure, ADA compliance, and overall safety of the sidewalks in Port Orange. The survey was conducted by Infrastructure Management Services, and they provided an Excel sheet that contained sidewalk segments, ramps, and obstructions on the sidewalk segments, such as utility poles and vegetation. The Excel sheet was difficult to use and did not provide a spatial insight into the data. It contained over 5,000 segments of sidewalks, as well as over 300 fields of information about the segments. They also provided PDF maps, which were broad overviews of the city, and GIS shapefiles. Working with my project client, who is the Deputy Director of Public Works for the city, I began to determine how GIS could be used to improve his access to the data and provide spatial insight. I determined that the static maps could be improved upon by generating a map series built off of a grid index laid over the data. I also believe that an online dashboard to provide dynamic access to the data built using tools in ArcGIS Online with some modifications from HTML and a proprietary coding language from Esri called Arcade to make modifications as necessary. I also conducted a spatial priority analysis using the Near tool in ArcGIS Pro. The results of my project can be seen here in the dashboard housed within ArcGIS Online. And inside the dashboard, my project client can search by sidewalk segment ID number, which will then filter down lists of segments and provide pop-ups that contain information from the Excel sheet, such as sidewalk material, the width, the length, and panel count. He can also view information from the spatial analysis that was requested by the ADA Action Team, which included determining the distance of segments from the hospital, parks, city facilities, and schools. Those distances were then ranked and combined with the condition data determined by IMS during the survey. This resulted in an overall priority value for each segment that was surveyed by IMS. As well as being able to see information about segments, my client can also view the ramps associated with the segment of interest or obstructions. He can zoom to the segment and get an overview of where the segment is within the city, as well as the condition of surrounding segments, which is important for planning repairs cost effectively. He can also click on the obstruction or ramp and get information about the obstruction or ramp if the segment has one. He can view information such as the type of obstruction, the action needed, and an estimated cost. Also within the dashboard is access to the map series that was generated. And the map series pages can be printed on 11 by 17 inch paper and provide a more localized view of the data than the overall city maps provided by IMS. This is important so that my project client can print the maps and they can be used in the field. Prior to the project, my project client and staff were having difficulty using the IMS data in the Excel sheet, but now have dynamic access to the data and spatial insight. This insight can be used to plan repairs to save the city money, as well as ensuring that sidewalk segments that are used frequently by the citizens of Port Orange are maintained and safe for all to use. This concludes my project presentation, and thank you for the opportunity to present.
Hello, everyone. I, Kritika Raman, a second-year student from Analytics Concentration at the Rutgers PSM Master of Business and Science, that is MBS program, welcome you as I share my journey of professional experiences through my academic program. Over the summer, I worked as a team lead for a team of 5 members on the externship project with City Venture Studio. Currently, I'm working with some students in the MBS department on a mobile application for students and alumni for enhancing leadership skills and continuing their journey beyond Rutgers MBS. Here are also some courses I've enjoyed, not to forget that there are a few more which I was not able to list here because there are just so many wonderful courses at Rutgers University. Talking about our project which we did over the summer, uncovering trends in human capital for college graduates. The aim of answering the question, where is top university talent working and which majors are trending at these universities? Based on online research, we determined to investigate STEM fields as our main area of focus, and we looked at information from top universities and key criteria that determines employability index. So upon doing some research, we realized that we needed to utilize a Selenium-based Python web scraper to pull over 500 LinkedIn profiles from such universities. Key attributes were major, roles, location, and time. With this information, we tied it all together and tried to identify correlation between ranking, location, and employability index, which subsequently answered the question whether a university's reputation impacted job opportunities available to students. So for the analysis piece, to understand the availability and deployment of human capital, we were able to plot the top 50 universities with their employability indices to find out that universities closer to major metropolitan areas had higher employability index. Additionally, when we took a deeper dive, we understood that higher ranking universities tend to have higher employability index. And the bottom visual shows that the income earned by STEM graduates is directly proportional to their unemployment rate. Now moving on to the conclusion phase of this analysis, we see that 1% of, we see the percentage of students with computer science and engineering majors who are inclined to work in professional, technical, and scientific service industries. And on the right, we see the representation of companies from LinkedIn sample, which I explained earlier, we used web scraping tool for. When broken down by school, we found that most engineering talent went to big tech companies. However, some universities also had financial firms within their top 3 employer category. For future recommendations, we suggested expanding search terms for scraper tool and using natural language processing technique like fuzzy matching to improve data analysis. We also recommend collecting data using a survey to understand skills utilized by the workforce, a university's reputation, future job direction and trends, but also the skills required based on occupation and job search channels. Now, along with being a student at Rutgers MBS, I also work part-time at Deloitte & Touche LLP, a Big Four accounting firm, as an audit data analyst. Along with my role of an analyst, I also enjoy being a well-being wizard and a member of the New Jersey Inclusion Council. Analytics has transformed audit in the past few years, where we have helped in executing effective and efficient audits by helping auditors discover insights from their data. And that helps them in their core audit process like sampling, outlier identification, and risk assessment. Since I transitioned to a part-time role at Deloitte, once I got enrolled in the MBS program, my role focuses more on deployment of analytics across global member firms. And I'm currently learning a new software to improve data wrangling and eventually automating some data prep procedures of an analysis. This will not only help us in saving time, but also ensure that we keep true to the concept of delivering effective and efficient audits. The overall outcome from all this learning has just been an experience gaining my technical skills, but also enhancing my personality to be a better leader. So to conclude, I would like to thank my professors, peers, colleagues for helping me become who I am, Professor Hoobler and members of NPSMA for providing the opportunity to share my experience. Feel free to scan the code on the screen and connect with me on LinkedIn to learn more. Thank you.
And our final presentation.
Hello, everyone. I will be speaking on my professional Master's of Science and Technology project, predicting outpatient demand to help with provider supply optimization. My name is Kendall Stauffer, and I am a current PMSD computational data science student at the University of Utah. I have a bachelor's in biotechnology, minor in chemistry, and I have about 4 years of analytics experience across multiple industries. My sponsors were Black Cliffs Partners and Path Integrated Healthcare. Black Cliffs Partners is a private equity firm located in Salt Lake City, Utah, and they own multiple outpatient mental health care groups. Path Integrated Healthcare is one of those outpatient mental health groups. They offer specifically therapy, psychiatry, case management, and medication management services. For my project, I wanted to be able to develop a forecast that would perform better than Path's current process. The reason being is that Path needs a better understanding of patient demand so that they can help with their staffing problem on the other side of this equation. I use tools such as time series analysis, literature review, to identify models that were used to answer similar questions, and then I trained and tested hundreds of models and identified a series of about 4 models that performed significantly better than Path's current process. Then lastly, I tried to develop a Jupyter notebook that had my results and everything explained in such a way that one of my business stakeholders would be able to pick it up and understand what I did. Time series analysis is the process of breaking apart a time series into a trend, seasonal, and error component. This is important because certain models allow for your data to have a trend and to have a seasonal component where others do not. And so for those simpler models, you need to be able to correct for your trend and your seasonality to be able to leverage them. And so in my data, I found that I had a strong weekly seasonal component that was driven by day of the week, and there was an overall increasing trend. So my average of patient demand was increasing over time. After time series analysis, I really wanted to know what other healthcare groups were doing within the industry in order to predict outpatient demand. And so I ended up doing a literature review, and I found the autoregressive moving average family of models, the exponential smoothing family of models, and Facebook's profit were all used to predict patient demand or something very similar. Now, the reason why the autoregressive moving average family of models is so important is because they're very explainable and very easy to understand. You can look at their coefficients and see how the different components of your model are being affected by your coefficients, making your model more interpretable. For the exponential smoothing, all you really have to understand is that there's a smoothing parameter and that they weight the time points further on in your time series heavier than they do in the past, leveraging the power of your more recent data. Then lastly, Facebook's profit is a forecasting framework produced by Facebook, and it allows you to use exogenous variables to better predict the future. And with this, it was used in order to predict patient demand. After my literature review, I created a training data set of about 13.5 months and a test data set of about 2 weeks. And then I optimized these using a stepwise research algorithm via AIC or BIC to pick the most simple and most accurate models. After that, I tested these most simple and most accurate models on my test data, which was 2 weeks. And I used my error metrics, root mean squared, mean absolute error, mean absolute percent error, to help me understand which models were the most accurate. This was done to ensure generalizability of the model. I ended up finding several Serema models and a whole winter seasonal method models that had a better or lower error rate than past current naive model. Lastly, I wanted to make sure my stakeholders could understand my analysis. So I used Jupyter Notebooks as a method to have them to be able to see my data visualizations, see my code, and also see the conclusions that I kept record of and wrote in business terms so that they could understand what I was doing. Lastly, I used data analytics to better understand patient demand. I was able to leverage that to be able to create many models that were able to predict better than past current model. Lastly, I would like to say thank you to my sponsor, Marshall Wetton Hayden Taylor, and to my committee for all their support during this project. Here are my references.
All right, with that, I want to thank our presenters, and I want to basically at this point open up the floor to questions. But I'm going to be selfish and take the first one myself. So if you have a question, if you either two couple things, you can put it in the chat, or you can raise your hand. And we've got a small enough group here. If you just want to raise your hand, I can then recognize you for the question. So my first question was just going to be for Cynthia, because you did something something unique there, and that you decided not to speak during your presentation, which is perfectly a legitimate way to proceed. But I was curious as to why you moved in that way.
I mean, I feel like I generally try to steer clear of having to read off slides. I know that everyone on this call is fully capable of reading, and so I felt that if I could present it, time it out just right, it would kind of go smooth enough. Did it?
I did. I thought it was very effective. I thought it was, it was something different, right? And so that's.
I feel like I've watched enough YouTube videos where they kind of take that exact approach, and people are addicted to YouTube, so I thought it'd be fine.
All right. If somebody else wants to jump in, I can keep going all day because I'm always having questions. But yes, Jerry.
Thanks to all our students for the great presentations. I actually have a question for all of you. If you reflect back to the time before you began your program, I'm curious as to how you learned about the program, and also if before you began the program, you appreciated the PSM nature of the program, even as you were applying, and if that stood out to you as a choice in making your decision to enroll in that program.
So I can call on individuals by alphabetical order if they want. Ashley, do you want to answer that first?
I can. Hello, everyone. I think especially for me in the GIS field, the PSM program made a lot of sense because it introduced me to a lot of technology that I hadn't been exposed to, such as coding, Jupyter notebooks, I think another student mentioned, and different concepts. And I work for the city of Port Orange, as I mentioned, and they really enjoy having me on staff. For one reason is I've brought the organization up kind of current trends in GIS, and I don't feel like I would have been able to do that probably like a traditional master's, but having the PSM program geared towards professionals has really helped me a lot.
Cynthia?
I actually worked for the University of Findlay at the time, and my undergrad work, like I said in my presentation, was in psychology. But from a professional standpoint, I did a lot of project work, system implementations, and so lots of things that were leaning towards an IT world. And I feel like the program was a natural fit to kind of combine my two worlds.
Jake?
Yeah, I first saw the program on the University of Utah website when I was looking for master's programs. And the day after I scrolled through that, one of my coworkers and previous classmates from my undergraduate was actually in the program. And so I got to talking with him about it, and it sounded like a really good match for me.
Kendall?
All right. So for me, I had some friends that were doing a different track than what I ended up doing at the University of Utah. And so that really kind of attracted me to the program. And then as well, I really did like how the program was flexible with my full-time work schedule at the time, and kind of had that business and data science emphasis on my case that I really wanted to try to address with my career.
Karika?
So I was aware of the MBS program as an undergrad at Rutgers while I was studying economics and math. And when I started at Deloitte, I was the only one on my team without any analytics experience. So I knew I had to come back to school at some point in time. But rather than traditional master's in data science, I figured that MBS is the best of both worlds, right? It's the business and the science. And to get to a leadership position at where I am right now, I know that this is a course which would help me jump the ladder instead of just like honing skills in analytics and kind of losing out on business and leadership.
Well, that's great. Thank you all very much. Congratulations again. And welcome as PSM alumni. And it's clear you're going to make great ambassadors for the program. So thanks very much.
Do we have another question? Yes, Scott. You're on mute, Scott.
I wasn't sure if my question was really worth asking, so that's why I was on mute. I have a question for Ashley. I first want to say I really enjoyed your presentation. And I think about, as I was seeing your presentation, I was thinking about an Excel spreadsheet that was just hundreds of rows of numbers, right? And then your beautiful interactive interface of being able to actually use that data. And so data really aren't any good if they aren't used. And I think that people that aren't even interested in sidewalks would want to use your data just because it's so fun to get in there and track around the city. So kudos to you for a really great job.
Thank you.
My question is, can you think of some other practical applications besides sidewalks that GIS data could be visualized to just help societal good? I mean, you know, other ways that would be applicable to your approach.
Well, one way that my project client has actually mentioned to me, just in his day-to-day workflow, he would go out and fix sidewalks, and then he would go out and fix some streets. And when they fixed the streets, they would run over the sidewalks he just fixed. So, you know, just in his day-to-day workflow, and for citizens that, you know, use their sidewalks, you get your street fixed and your sidewalks are messed up. So just as a planning perspective to help the citizens, he can now look and see, okay, I'm paving these streets and the sidewalks aren't in good condition, so I can hold off on those sidewalks, wait till the streets are done, then do the sidewalks, so that like an entire neighborhood is improved, the streets and the sidewalks. Here at my job at Port Orange, we applied GIS to a lot of different departments. We've worked heavily with community development for flood zones and things like that, and for planning. It can really be applied to anything that you can think of. And as you mentioned, big data sometimes goes unused, and there were several times before that the city had done surveys similar to the sidewalk data that just wasn't being used because it was, like you said, the spreadsheet is enormous that I pulled the data from. So I think actually spreading the word of what GIS is capable of, which was a big component of this project, will actually help us apply it in different areas to the benefit of the citizens.
Thank you.
I have a question for Karika. So with your work, you were basically scraping the LinkedIn site. Did I understand that correctly?
Yes.
So that's becoming harder and harder. So you mentioned that you're continuing to do that work, but supplementing it with surveys. Kind of what do you expect to change as you move forward with if this project moves forward and with these changes that you mentioned?
So the idea for the project was to try to sample out the information. So we started to use the LinkedIn scraping approach. However, we did hit some dead ends, and after a point saw, even though we got like initial insights, there's no like a proper reason. Like someone had interned at, say, a Google, but then they accepted the final job offer at an Apple. So it wasn't very clear as to if you've had like 1 year of experience at a very good company, why you would accept a full-time offer at somewhere else. And we decided that survey is a better option to do it. That said, this was just a project we were working on over the summer, and then City Ventures is going to implement it the way they see fit. It's governed by the NDA, so we really don't have a lot of insights on what they ended up doing or which approach they would be taking.
Thank you. Okay, I have a question for another question for Cynthia. So Cynthia, so you mentioned at the beginning of your presentation that this was all done before the COVID-19 pandemic. Would you care to make a comment on maybe how things have changed, or do you think things would have drastically altered your work if you had started that project today?
So yes.
How would it have altered your work if you started that project today?
Well, I think that this topic is a lot more, it's in the front of everyone's minds now. We think about it more, where when I was having this conversation over a year ago with the people in my peer circles, they were like, well, yeah, of course, people prefer face-to-face interactions. But my argument was, we don't have any data to show what the differences are and what those effects are of choosing the virtual options. So I think that people are going to start talking about it a lot more. I think it's going to be a lot more important. I mean, obviously we don't have an option right now, but there will come a time where we do have options again. And I think we're going to have more data to look at now too.
Jake, in your work, I had the advantage of seeing all the videos beforehand. So, you know, I had a chance to really digest everything. So that's my unfair advantage to being the moderator. When you mentioned about the process that you did in terms of qualifying, you know, the instrumentation that's used in your work, is that something that's been more fully adapted for other projects inside the company? Did they see the value in that type of qualification, systematic qualification as they do the submissions for various approvals?
Yeah, so the qualifications is required, you know, by the FDA for your submissions, but definitely it gave us a lot deeper insight into each of those analytical methods that we employed for the development of the discogenic cells. And we're able to make a couple changes to have processes be more efficient, as well as better data extraction. So definitely it was so that was one of the first qualifications that we did on the QMOD, and, you know, able to get more data and look at things a little bit deeper, you know, on subsequent qualifications.
Okay, thank you.
If that answered your question.
Yeah, no, it does. It's always nice to know that the work that you do is you know, is transportable, right? And that leads me to my final question I have for Kendall. So Kendall, your work is pretty generalized in terms of applying it to, in this case, patient care, patient demand. But can you maybe comment on the skills in terms of how portable this is outside of that particular area and what you're planning to do next?
Well, that's a good question, Ray. And so with it, so I guess within the aspect of the patient demand side, what we're really hoping was be able to understand one side of the supply and demand question that we're having at our outpatient mental health facilities. And so looking at the supply side of things, is our hope is that by being able to predict the number of patients that we're going to have at a facility, we'll be able to better staff the proper number of providers, thus reducing things like employee burnout because they're working a lot of overtime, and helping increase revenue and doing all these sort of things to increase patient care. I don't know if that answered your question, Ray.
It basically did. I was just looking at, in terms of like applicability to other industries that you might be looking at?
Oh, okay. So in terms of it, I guess generally speaking, in terms of forecasting in this case, it's applicable for a lot of people use forecasting in order to better look at the revenue cycles and whatnot, right? And so in terms of the applicability of forecasting, I guess it's just a common tool that people use widely.
Okay, thank you. Other questions? Yes, Seema, you're on mute.
Great job, all presenters. Since you're all on screen, I was wondering if just by a show of hands, you could, I seem to remember Krutika said that she is part-time employed. Are the rest of you all employed right now? Or if you could just show of hands, so what one is not yet employed. I guess I
Jake's
could ask,
employed.
Oh, he is employed?
Yeah.
Okay, so that's great. That's one of our goals in the PSM program is to either, well, of course, we train working professionals, but then also have students coming out of degrees get employment, which is fantastic. I'm also curious, how many of you are working remotely, or are you working in person? Because I'm assuming most of your capstone was not done remotely. Is that correct? So most of this was done prior to COVID. Am I right?
Yeah, I finished right when we went into quarantine, and I am now working remotely.
You are working remotely. I guess, you know, our next batch of students are going to be the ones who will have done their internship remotely. But I want to know what kind of transition it has been for you, having gone from, you know, into a new job or continuing your job in the remote world.
So should we go backwards in alphabetical this time? So Greta, you want to take that first?
Sure. So I've been working with Deloitte on and off remotely. So since 2016, I would say I was remote for a year, went in for around 6 months on a project, and then I've been remote. So professionally switching remotely was not very difficult. However, with MBS, I'd been 1 year in the program, been on campus, and the externship program was the first time I actually worked on a professional project with Rutgers. So it was kind of difficult initially because the undergrads and grad students I was working with had never worked remotely. So trying to, you know, make them open up. We had like a Teams channel going for them to communicate, had activities before every call just to like get them excited about this work. But also with the company mentor, because City Ventures had some technical restrictions, whereas at Rutgers we had license for Teams and Zoom and things like that. So they would just be allowed to use Cisco WebEx. So it's just like working through that took us a week or two. But overall, I would say it was a good experience. Of course, I've not done it in person, so don't know how it is. Definitely recommend that with the incoming students, some training around virtual presentations or working would definitely help.
Kendall?
On my side of things, to kind of answer both the questions, I actually did my whole project remote for the company I'm working with during COVID. I started in the summer and just ended not too long ago. And so with that said, transitioning to working remote full-time has been an interesting change from being in person. And currently at the job I'm at for the company I did everything, I actually haven't met anybody in person either. So everything I've done has been via Zoom or via Teams and talking with them. We keep a kind of an open Zoom channel for employees to log in and out of, just so that we can chat throughout the day. You know, I was trying to replicate that in-office kind of chat system and things. And so I feel like for incoming students, people that need to do their projects remotely, being able to have good calendar skills is just as important as before. And then also getting familiar with whatever technology you use, because I use Teams and I use Zoom here. At other companies I've worked with, we've used WebEx. So really trying to familiarize them with some of those technologies, I think would be a huge help.
So Jake?
Yeah, I finished my project in December, and so right before the quarantine business. I use a lot of analytical equipment and primarily in the laboratory for much of my work. So I still have to go in, but then like the previous presenter just said, yeah, getting familiar with the new type of programs that we're utilizing because we rolled out a lot of the Microsoft Office stuff during COVID. And so becoming familiar with those before starting a project would be definitely helpful. And then you just have to organize your time when you're going into the laboratory, you know, for those different regular or the amount of people that you're allowed to have in the office and, you know, going through all those type of things. So just coordinating with people a little bit better and communicating, you know, through the computer rather than talking to them, you know, at their, you know, office booth. So that was a little bit of a change, but yeah, it's working out.
Cynthia?
I finished the program in April and finished my project in April, but I actually had started a new job in February and then got sent home to work from home like the first week of March. So while I thought I was going to be relocating, those first couple weeks trying to juggle the two, I had like an hour and a half commute. And so I welcomed coming home and finishing the project from my dining room.
Nice. Ashley?
I started my project in January, just when COVID was just kind of a rumbling in the news. And then we went fully remote for about a month in March and then kind of came back, and we're still in a little bit of a hybrid, couple of days in the office. I'm in the office today. And I think for me, as far as the project, because interacting with my project client was so important, I wanted to check in with him and make sure the dashboard was going to be usable for him, that it contained everything that he needed, and was user-friendly was really important. So we use Teams here at Port Orange. So doing a lot of screen shares and sharing my screen with him or letting him take control and click around, make sure everything was working properly and suited to his needs was very important. And I definitely agree that good calendar skills, written communication is so important, you know, coordinating and making sure schedules align.
Thank you.
Mm-hmm.
Any other questions? With that, I'm going to say once again, to thank all of the presenters. I recognize that in some ways, putting a video together is more work than having a slide deck and just presenting to it. So thank you for that extra effort. I know it was really appreciated. I think that you all have gone through a pretty interesting phase here with this kind of coming through the program, either touching at some point this whole incidence with COVID as we're working in this new work world. So hopefully all the communication skills and the technical skills that you've been building up are being put to good use. So with that, I will turn it over to Amber so she can basically close out the conference. Amber.
All right, thanks again, everyone. Thank everyone for attending, students for your time and effort in those videos. So that's it. I hope to see everybody here in our next conference next year in person, if possible, in Tampa. So again, thanks everyone. Have a good afternoon.
Thank you.
Thank you all.